My name is Sipora Marowitz, and today's date is June 29th, 2022. And my topic today that we will be discussing is cystic fibrosis. So, a typical patient presentation is when a 6-month-old baby that was born in England came to the United States with his parents when he was 2 months old. He presents with wheezing, thick mucus, weight loss, and severe constipation. His great-grandmother died of cystic fibrosis, but no one in his family has been diagnosed with it since then. The baby comes from a Caucasian family with a family history of living in Northern Europe. So there are many causes of cystic fibrosis, or the etiology of cystic fibrosis. One of them is it's a hereditary condition brought on by a flawed gene that can be handed down through the generations. The gene that causes cystic fibrosis is the cystic fibrosis transmembrane conductance regulator, or the CFTR gene. The CFTR gene can disrupt the normal functioning of the CFTR protein that is found in the cells in the lungs. This can prevent the flow of chloride ions and water that goes in and out of cells. Some background information on cystic fibrosis. Cystic fibrosis is one type of monogenic inheritance disorder. Cystic fibrosis results from mutations in the cystic fibrosis transmembrane conductance regulator gene, or CFTR. CFTR is located on the long arm of chromosome 7. Cystic fibrosis is an autosomal recessive condition, meaning that a child must inherit the CFTR mutation from both parents. Cystic fibrosis is the most common and lethal recessive disorder that is found in white children. The number of patients in the United States that are diagnosed per year is around 1,000. The number of known mutations for cystic fibrosis is around 1,800, and therefore they are divided up into 6 different classes, depending on how severe it is. Classes 1 through 3 are the more severe diseases. Classes 4 through 6 are the milder diseases that are associated with pulmonary and pancreatic insufficiency. The amount of new cases of cystic fibrosis is around 1,000, and many of whom get diagnosed at the age of 6 months. Many people who have cystic fibrosis live until around the age of 40. Risk factors for cystic fibrosis include, but not limited to, genetics and family history, and people of Northern European descent. The pathophysiology of cystic fibrosis is the CFTR protein enables chloride to travel through the mucus-producing cells, where it is then followed by water and thin mucus. However, CFTR deficiency causes thick, sticky mucus to clog the airways, which causes deadly lung infections, particularly those caused by pseudomonas. Due to the additional sodium that is lost through perspiration, there is also an imbalance of minerals in the blood. The lungs, lung development, structure, and function are adversely affected by obstruction, infection, and inflammation. There is a decrease in the mucociliary clearance. The breakdown of supporting tissues can cause bronchiectasis and eventual failure. High neutrophilic response that occurs in conjunction with infection. The pathophysiology continues. The cystic fibrosis transmembrane regulator, or CFTR, that affects the respiratory tract, pancreas, intestines, male genital tract, hepatobiliary system, and exocrine sweat glands, resulting in multi-system disease. The complications of cystic fibrosis are severe respiratory virus infections. Due to the imbalance of minerals within the blood, it can lead to dehydration, arrhythmias, exhaustion, weakness, heat stroke, and very rarely death. Intestinal blockage. This can occur in newborns with cystic fibrosis. It results from meconium ileus. Symptoms for cystic fibrosis include wheezing, persistent cough with thick mucus, stuffy nose, repeated lung infections and sinusitis, dyspnea, anxiety, cough, and pain. This is for the end of life for those who are dying of cystic fibrosis. The anxiety is from being scared of dying. Many patients disclose that they feel pain in different areas of their body. The most noticeable one is lung pain. This pain feels as if a sharp, cool breeze is hitting their lungs. Symptoms for cystic fibrosis include bad smelling stools. The reason for this is because without digestive enzymes, the intestines are not able to absorb the nutrients from the food. Substandard weight gain. This is due to the energy being used to breathe normally, so the body needs around twice the amount of calories to maintain the weight and gain weight. Chronic or severe constipation. The mucus is thick that it causes food that has been digested to be blocked in the intestine. This can cause gas, cramping, constipation, and pain. How to diagnose a patient with cystic fibrosis. While cystic fibrosis can be diagnosed later in life, it is most commonly diagnosed through newborn screening done within the first few days after birth. An early diagnosis can help improve a baby's overall health and delay or prevent serious health problems related to cystic fibrosis. The first step of testing involves drawing blood from a heel prick and placing it on a Guthrie card. A Guthrie card is when the neonate's pricked heels are frequently used to collect blood spots for screening purposes for conditions such as phenylketonuria, cystic fibrosis, and sickle cell disorders. This blood will be used to check the levels of a chemical made by the pancreas called immunoreactive trypsinogen, or IRT. The reason why immunoreactive trypsinogen, or IRT, is high is because the CFTR gene leads to an obstruction in the pancreatic duct. IRT is a protein that is made by the pancreas. RT is naturally found in the body, but people with cystic fibrosis generally have a higher level of this chemical. IRT levels can also be elevated due to other reasons, like a stressful or premature delivery, so sweat testing is used to confirm the diagnosis of cystic fibrosis. A sweat test measures how much sodium is in the baby's sweat. This is the only test available to diagnose cystic fibrosis, but there are other tests that can help confirm the diagnosis if the sweat test results are inconclusive. A sweat chloride test is only ordered if the newborn screening test comes back positive. The sweat chloride test is a confirmation test when the screening test comes back positive. Treatments for cystic fibrosis patients. Treatments for cystic fibrosis include chest physical therapy, antibiotics, human growth hormones, and a lung transplant. The first type of treatment that many patients with cystic fibrosis will try is the chest physical therapy. The goal of this therapy is to clear the mucus, and they use a bronchodilators with some aerosolized Dornase alpha and hypertonic saline. This helps make the mucus be more like a liquid. The second type of treatment is to give patients some sort of antibiotic. The type of antibiotic depends on the different types of pathogens. Staphylococcus aureus and Pseudomonas aeruginosa are the two pathogens that cystic fibrosis patients are at high risk for. The third type of treatment is to give patients a human growth hormone. What this hormone will help is the lung function, height, and weight in children that are diagnosed with cystic fibrosis. The last treatment is a lung transplant. This is considered to be the last resort a cystic fibrosis patient should try. A lung transplant is for the patients that have end-stage lung disease. For future treatments, there is gene therapy that is being explored. Here are the references that were used in making these slides. Thank you and have a great day.